here's a slide about the balancing of two goals. And the problem is that sometimes we pay more attention to advancing science as opposed to the protection of human subject research. You know, I just thought about it. Another example is a big discussion nowadays is developing a vaccine for the coronavirus. There's two ways to develop a vaccine. One, you develop the vaccine and then you take a population who is in an exposed area and you give them the vaccine and then you see what happens. You know, you have a control group and a vaccinated group, and after 6 months you see the results between the two groups. Now, another way to assess a vaccine is to give a group of participants the vaccine and then purposefully infect them with the virus to see what happens. And people say that could speed up the process. You know, obviously you want to advance science, but a lot of people are concerned about the risks involved with purposefully infecting someone with the virus. Now, a lot of people say that one could make it very safe. If they get the illness from the inoculation, then hopefully there'll be drugs to treat that. We don't have yet many good drugs to treat the coronavirus. So that would be an example whether, I mean, there's a tension between advancement of science. Obviously, developing a vaccine would be very important for public health. One may, you know, say, well, there are risks, but the advancement of science would be huge. So that would be an interesting example on how you balance science versus risks to participants. Just looking back quickly with the history of research ethics, you know, before the 20th century, research was really small scale, involving just a few individuals. However, starting with the 20th century, we started doing research larger scale, collecting data systematically on groups of individuals. However, a lot of those individuals were what we call vulnerable groups. And these vulnerable groups included prisoners, orphans, and frequently those who were mentally ill. And the problem back then was that there was no formal code of research ethics. And then came the Nazi experiments during World War II, and they did, and a lot of the human subjects were led to their deaths, and the Nazi doctors were put on trial for the murder of those individuals. And several of the doctors were found guilty and hung. So the Nuremberg judges asked, well, how could doctors participate in these experiments? I mean, they took a Hippocratic oath to do no harm, but obviously that wasn't enough for research. So the Hippocratic oath is not applicable to research. It's only applicable to clinical medicine. So the Nuremberg judges said, well, we have to take the do no harm from the Hippocratic oath, but combine it with a concept of human rights. I mean, when you do research, you have to pay particular attention to the human rights of those individuals. The Nuremberg Code is a combination of human rights and welfare of subjects. And so the Nuremberg Code contains 10 principles, and the first and longest principle is that the voluntary consent of the human subject is absolutely essential. And Article 9 says subjects have the rights to withdraw at any time. So those are the two most important rights, voluntary consent and the right to withdraw. And then we have Articles 2 to 8 and 10. The research must have scientific value. There must be a favorable risk-benefit ratio, and subjects and suffering should be avoided at all costs. Every research project has some risks, and our obligation is to try to minimize that risk as much as possible. Even after the Nuremberg Code, there were still violations of research ethics all over the world, including the U.S. An important paper was published in the 1960s by Henry Beecher, who detailed several studies with ethical concerns. One study involved withholding antibiotics from patients with rheumatic fever. Another study involved infecting institutionalized children with hepatitis, which was the Willowbrook experiments. Another one involved injecting live cancer cells into nursing home patients. And essentially, his article demonstrated that abuses and exploitations of humans in research continued despite having ethics codes. Then there was the Tuskegee syphilis experiment, where African Americans were enrolled in a study that followed the natural course of syphilis. And African Americans, and they did spinal taps on African Americans, and the African Americans were told that the spinal taps were actually a form of treatment. So ethical concerns involved inadequate disclosure of information. Subjects thought they were getting free treatment, told the spinal taps were therapy. And the most important ethical issue about that study was that now this study began in 1932. During World War II, with the discovery of penicillin, which was used for the treatment of syphilis, the people enrolled in this study, in the Tuskegee syphilis study, were not given penicillin treatment because that would ruin this study looking at the natural course of syphilis. And so these participants in the research was denied treatment. And finally, in 1972, the government stopped the study. After that study, we have in the U.S., they passed the National Research Act, okay, which issued the Belmont Report. And essentially, the National Research Act demanded that there be independent review of research by institutional review boards, because the ethical review of research could not be done by investigators because they have a conflict of interest. And so the Belmont Report articulated the principles of research ethics. And this included autonomy, and this is the Arabic version of autonomy, Hagal Ikhtiar. However, the Belmont Report did not emphasize autonomy. They emphasized respect for persons, which is Ihtiram al-Ashkash. And then the other important principle is beneficence, al-Bayader, and then justice, al-Adl. Justice means do not exploit vulnerable subjects, and there needs to be a fair distribution of benefits. So we have four major principles: autonomy, or respect for persons. A lot of people involved in research are not autonomous. We need to do research on children, people who are mentally ill, prisoners, because we need to study the illnesses that these groups have. However, we have to respect them. And one way of respecting these individuals is to get informed consent from their family member or some other legally authorized individual. And let me just say a few words about international research. And something that we'll go over is that there is the Declaration of Helsinki, and then there's also the SIAMS document, and we'll talk more about that when we talk about international research. Okay, so we have these 4 principles, but the issue is, how do we operationalize these 4 principles into ethical requirements of research? I mean, how do we specify it? How do we make it more usable when we research? So here, I want people to help me out. You see this slide with a lot of terms, okay? Why don't you use your annotation tool and start circling which of these items are considered ethical requirements for research. Now, you annotate. I don't need to know who you are, okay? So you remain unidentifiable. So help us out here. Okay, informed consent, confidentiality, social value, good. Honesty. Now, okay, hold on for a second. Now, honesty. Now, that's a very important word, okay? But when an ethics committee review research, how do they assess honesty of the research proposal? We're talking about ethical requirements for the review and conduct of research. Now, obviously, you want integrity and honesty. I don't doubt that. But when an ethics committee review a research proposal, they don't really assess your honesty or your integrity. Well, we'll talk about responsible conduct of research, okay? But in reviewing a protocol, we have informed consent, confidentiality, minimization of risk, social value, objectivity. Again, that's an IRB is not going to be able to assess objectivity. Now, I guess you may want to talk about conflict of interest. If that's what you mean, then I agree with that. Hard work. Well, an IRB is not going to assess whether you're a hardworking person, right? So, I mean, all these words here are good words, good values, but we're talking about the ethical requirements for the review and conduct of research. Scientific validity, yes, I agree. What else? So we got social value. I'll put this in if you meant conflict of interest. What else? Yes, fairness in the selection, justice, responsible publication. Well, that's after the research is done. Don't confuse this with responsible science. Respect for intellectual property. Well, that's after the research is done. Oh, there's probably one more thing left. Yes, privacy. Right, very good. Excellent. All right, very good. So, all right, good job. So here on the website, there's this paper entitled What Makes Clinical Research Ethical? Guidelines for Research Ethics. For every research has to have social value, scientific validity. I mean, if your research is not conducted well to get good data, then you're exposing individuals to the risk of research for no purpose. Fair subject selection, favorable risk-benefit ratio, informed consent, respect for enrolled subjects doing the research. So you want to make sure that you're doing the research in a safe way and you're monitoring the research for injury, and you need independent review. Okay, and so if you ask a lot of people what are the major principles for research ethics, most people will say informed consent, and then they won't say anything else because they don't realize they have to look at fair subject selection, risk benefit, respect, independent review, has to have social value. This is how you operationalize the principles of research ethics. This is the agenda.